Recently I made a video about the Senate version of healthcare reform, pointing out how it had become a clone of the Massachusetts healthcare law, and detailing how both violate federal racketeering laws concerning extortion. I thought I was alone in this observation. And then I saw Keith Olbermann.
Last night on this program, Howard Dean said that with the appeasement of Mr. Lieberman of Connecticut by the abandonment of the Medicare buy-in, he could no longer support H.R. 3590. This is not health. This is not care. This is certainly not reform. This bill, slowly bled to death by the political equivalent of the leeches that were once thought state-of-the-art medicine, is now little more than a series of microscopically minor tweaks of a system which is the real-life, here-and-now version of the malarkey of the town haulers. The American insurance cartel is the death panel, and this Senate bill does nothing to destroy it. Single payer, the public option, the Medicare buy-in, before they vanished. The Congressional Budget Office estimated that the part of the bill that would require you to buy insurance, unless you could prove you could not afford it, would cost a family of four with a household income of $54,000 a year, 17% of that income, $9,000 a year, just for the insurance. That was with a public option. That was with some kind of check on the insurance companies. That was before, as Howard Dean pointed out, the revelation that the cartel will still be able to charge older people more than others, will at the least now be able to charge much more, maybe 50% more, for people with pre-existing conditions. Pre-existing conditions. You know, like being alive. You have just agreed to purchase a product. If you do not, you will be breaking the law and subject to a fine. You have no control over how much you will pay for that product. The government will have virtually no control over how much the company will charge for that product. The product is designed like the Monty Python sketch about the insurance company's never pay policy, which, you know, if you never claim, is very worthwhile. But you had to claim, and, well, there it is. Mr. Grassley of Iowa has lied and fomented panic and fear. Mr. DeMint of South Carolina has forgotten he represents people and not just a political party. Mr. Baucus of Montana has operated as a virtual agent for the industry he is charged with regulating. Mr. Nelson of Nebraska has not only derailed reform, he has tried to exploit it to overturn a Supreme Court decision that is, in this context, frankly, none of his goddamn business. Which brings us to Mr. Lieberman of Connecticut, the one man at the center of this farcical perversion of what a government is supposed to be. Out of pique, out of revenge, out of betrayal of his earlier, wiser, saner self, he has sold untold hundreds of thousands of us into pain and fear and privation and slavery for money. Mr. President, they're calling you a socialist, a communist, a Marxist. You could be further to the right on this than Reagan, and this health care bill, as Howard Dean put it here last night, this bailout for the insurance industry, that sure invites the Reagan comparison. And they will still call you names. Sir, if they're going to call you a socialist, no matter what you do, you have been given full, unfettered freedom to do what you know is just. The bill may be the ultimate political manifesto, or it may be the most delicate of compromises. The firestorm will be the same. So why not give the haters, as the cliche goes, something to cry about? You have riven them, sir. Any bill will engender criticism, but this bill costs you the left and anybody who now has to pony up 17% of his family's income to buy this equivalent of medical mobster protection money. There is only one redemption possible. The mandate in this bill under which we are required to buy insurance must be stripped out. The bill now is little more than a legally mandated delivery of the middle class, and those whose dreams of joining it slip ever further away, into a kind of Chicago stockyards of insurance. Make enough money to take care of yourself and your family, and you must buy insurance on the insurer's terms or face a fine. This provision must go. It is, above all else, immoral and a betrayal of the people who elected you, sir. You must now announce that you will veto any bill lacking an option or buy-in, but containing a mandate. The Senate bill with the mandate must be defeated, if not in the Senate, then in the House. Healthcare reform that benefits the industry at the cost of the people is intolerable, and there are no moral constructs in which it can be supported. And if still the bill and this heinous mandate become law, there is yet further reaction required. I call on all those whose conscience urges them to fight to use the only weapon that will be left to us if this bill, as currently constituted, becomes law. We must not buy federally mandated insurance if this cheesy counterfeit of reform is all we can buy. No single payer, no sale. No public option, no sale. No Medicare buy-in, no sale. I am one of the self-insured, albeit by choice, and I hereby pledge that I will not buy this perversion of health care reform. Pass this at your peril, senators, and sign it at yours, Mr. President. I will not buy this insurance. Brand me a lawbreaker if you choose. Fine me if you will. Jail me if you must. But if the Medicare buy-in goes, but the mandate stays, the people who fought so hard and so sincerely to bring sanity to this system must kill this mutated, ugly version of their dream, because those elected by us to act for us have forgotten what must be the golden rule of health care reform. It is the same rule to which physicians are bound by oath. First, do no harm. Good night and good luck.
So what do you think? Will you boycott the insurance companies if this kind of extortion is passed, as Keith Olbermann suggested? Or are you simply so tired of the fighting that you'd be willing to pay the extortionists just to end the fight?